Health Hub. I'm a social scientist within the CI Hub at the College of Medicine and Health Sciences, where my role, or mainly my daily duty, just to coordinate the trainings. And one of the trainings that we have in our CI, jointly with CI Malawi, is exploring the role of entrepreneurship in driving innovation and advancing health. It's a privilege to me to be part of this webinar to share a little bit of what I have, which is also linked to my day-to-day duties of teaching. I do teach one of the course, which is close-cutting course, that is called Innovation and Entrepreneurship. And we teach it to all the undergraduate as well as postgraduate students. So that is how this presentation is linked with what I do on a daily basis. When we look at the topic that we're going to unpack, which is exploring the role of entrepreneurship in driving innovation and advancing health, it is actually looking at how do we innovate, and by innovation, how do we incorporate entrepreneurship activities to make sure that we tackle the issues related to addressing issues that are dealing with universal health coverage. So that is mainly what this topic is all about. Before we go into deep, we are going to mainly look at, as an outline, the concept of social innovation. Then we shall tap into entrepreneurship and its models. Then you look at what is the link between entrepreneurship and social innovation. Then after that, we shall unpack on how entrepreneurship-driven social innovation in Rwanda are being done in relation to, universal health coverage. So when you talk of the concept of social innovation, we normally start with understanding what is innovation per se. So the definition from the Organization of Economic Cooperation and Development tells us that innovation is simply implementation of either a new or a significantly improved either product or service, or a new marketing method, an organization method, in a competitive ecosystem. So that is a simple term of what is innovation. Then, when we bring in the concept of social to add it to innovation, it becomes now something that is more, socially. That definition comes from the Social Innovation Academy, which stresses that social innovations are basically the innovation that is social in its end, that is, has a social impact, and simply it can be either a working or innovative solution to help address a pressing societal challenge. In these challenges, we might talk about climate change, for instance, social exclusion, mobility, or health issues. So any innovation that is social in its end is defined as a social innovation. Then when we go to the definition from WHO, it describes social innovation in health as anything that tackles services or products which are aiming at transforming healthcare to meet the universal health coverage. So this is the ultimate goal of social innovation within the health system context. Anything that is tackling universal health coverage is defined as a social innovation. And that includes management systems. We might also talk about top-notch health devices, health financing systems, community initiatives, etc. Then we are talking about social innovation. Then we try to link it with entrepreneurship. Then for us, we need to understand what's entrepreneurship. I think most of us know what is entrepreneurship, which is in simple terms, the willingness to take risks, be able to develop, you organize yourself, and manage a venture, which might be a product, a service, or a process in a competitive market. And this it's not comes as an isolation with the humankind. We are created innovative, hence entrepreneur. when you look at the historical perspective of humankind, it tells us that we are created innovative. For instance, we have been in the cave once we were created, and imagine coming from someone who is living in a cave to know. So you can see this innovation process. For instance, from traditional medicine to top-notch medical discoveries. For instance, you look at the surgery, surgical procedures that humankind is doing nowadays, the discovery of anesthesia, CT scans, MRI, and etc. So these are some of the examples that we might highlight, which shows us that we are created innovative, and that is what makes us entrepreneurs. At the core of this trend is the risk and innovation which has produced entrepreneurs, which we all capable of being. It's like from this trend, the humankind being able to take risks and innovate, that is what is making us entrepreneurs. Then when we talk of models, entrepreneurship models, sometimes we need to distinguish models. We need to get distinction between business plan and models. So most of us maybe are familiar with business plan because that is something that is meant for you. It's a document that is designed maybe to be submitted to the financial institution for you to get a loan or get funding. So that is a business plan. But in a new competitive world, business plans are failing to help startups compete because startups do not have, these financial muscles or the collateral to be given to the banks. So what is now being useful, they are therefore entrepreneurship models, which in most of cases are simple and flexible model, which shows how the business can be changing in its landscape, and that can be used to deal with contemporary issues that affect humankind, including basic health needs. So in fact, when you talk of a model, it's just a philosophical thinking of how either a business or a system or organization will compete in a global competitive world. So the model is actually, in a simple term, is a plan for the successful operation of a venture, which identifies the sources of revenue, the intended customer base, products, and details of financing. It illustrates the venture, what it does, for whom, and with whom. And it also shows the resources that is needed to do that, and money flows in and out of the venture. This is the business or the entrepreneurship model. And the generic form of entrepreneurship model is what we call a lean canvas. It's a canvas which has 9 blocks, different elements, 9 blocks. We shall look at it later. But normally we are familiar with some business models that, for instance, there is a way of subscribing to any business. We pay by subscription. There is what we call e-commerce, marketplace model, on-demand model, franchise model, platform as service, many others. So these are some of the examples of the existing model that, in business environment, which are quite different from the canvas we are going to look at. So the lean canvas, that is, entrepreneurship model, as I said, it has 9 blocks, which normally starts from the problem. You analyze the problem. You say maybe we have climate change problem. Then you highlight what are the maybe top 3 solutions that you need to mention. What is the uniqueness of your solution? How is it your solution unique? And this has to be single, clear, comparing, method. Why you are different and worth paying attention. There is another block that you have maybe to mention. What is your advantage? What is an unfair advantage? Why you can't be easily copied or bought. So another segment will be discussing, summarizing customer segments. What are your customers, the target customers? What is your niche market? That is the early adopters. Then you need to mention the key metrics. Those are metrics that you use maybe to measure your progress, key activities you can measure. Then you need to highlight also the channels that you're going to use to reach your customers? Maybe by distribution? Are you going to use social media? And so far and so forth. Then another block within the business model, it will be what we call cost structure. Within the cost structure, that is what will be the expenses, either customer acquisition, distribution costs, variable costs, fixed costs. In fact, anything which talks about money will be, in terms of expenses and inputs, will be highlighted in cost structure. Then another stream we'll be talking about the revenue stream, or the other, which is the block. How will your venture make money? So is it maybe by selling products? Are you going to sell services? And so far and so forth. So this 9 block is what is, showing us what is a business model. Then for us to understand this, we need to look at what is the actual model. This is just an example of the model. I have extracted this model from one company which deals with, it deals with correcting waste materials in sanitation, deals with environment, climate change and environment. And this one was, it is, within the community in Kigali, and it works with Rwandan Environmental Management Authority and UNDP. Within their key activities or the key solutions for them, they correct the waste materials and other organic wastes, such as peat and et al. So they also have organic fraction separation as a service, and the production and sales of briquettes and compost. Then they have some promotional campaigns. So these are the key activities or key solutions. So the problems that has to be addressed was linked to cleanliness, and this is linked to public health. So when you look at what is happening in Rwanda in terms of cleanliness, there are companies, behind this success. One of them is this one, which deals with waste correction. So their value proposition, it is actually waste correction service, which is environmentally friendly, and from those these wastes, they manufacture briquette. And this briquette, they are in forms of charcoal that are cheaper than charcoal and wood. So they are also manufacturing organic fertilizers, that is the compost. Then purposely built briquette stoves. They also build some stoves in which you can use these briquettes. Then what are the customer relationship or the customer segment? So they have a link with household for collection of the waste. Normally we do pay like monthly contribution as household. Short and long-term contract, you sell and briquette with institution customers. They also have community household and Kigali Council. There are also prisoner schools, briquette factories, and household. So these are the customer segment that they are targeting. Then you can now try to refer to the business, canvas or entrepreneurship model I was talking about. Look at now the key resources. They are talking about consumables, human resource capital, land provided through partnership, equipment, and certification. Then what are the channels? How are you going to reach customers? Or are you going maybe to collect their waste? There is a direct personal help at the point of source of waste in the household. Then they also have this direct contact when they are selling of briquettes to the household. They can also do supply of briquettes to institutions like prisons, as I said before, or other institutions. Then this is the cost structure I was talking about. They highlighted that they need an investment cost, which would building, which will be, using 67% of the total investment. They needed machinery, operation costs, and so far and so forth. Then what are the revenue streams? How are we going to make money? Where is the source of profit? One of them is waste collection fee, which our household have to pay on monthly basis. We used to pay, I think I pay 4,500. This is paid, depending on the the income of neighborhood. In our neighborhood, we do pay 4,500. That is around 4 USD, something like that. Then get cells. They do also sell briquettes, compost cell, and stove cells. When stove is just minor revenue. Then, looking at the entrepreneurship model, you can add some other blocks, which is more than maybe 9. They have added social and environmental costs and social environmental benefits. So they were just showing what is the benefits in terms of environment. So you can now look at this model and see how it is simplified for someone who is just doing a startup. You're just summarizing what you intend to do as a business or as entrepreneurial activity. Then we need to look at the link between entrepreneurship and social innovation. Are we still together? Hello, participants? Yes. Are we still together? Yes, let us proceed.
Yes, we are together.
Okay. Let's now look into entrepreneurship and social innovations.
Yeah, we are following.
Okay, social innovation that address community health challenge might be entrepreneurial in nature, which might also encompass health initiatives from community members themselves to bring either tested and trusted affordable health services or products or solutions closer to communities. So those entrepreneurial activities that are really addressing healthy challenges that are closer to communities are social innovation in context. So any entrepreneurial activity that is dealing with, a social or a health challenge that is closer to community is called social innovation or entrepreneurial social innovation activity. For us to achieve this ultimate goal, we need to call all stakeholders, including public and private sector, to work together, because the government cannot do everything. The private sector also needs to play a very big role in doing so. We shall see even some examples, maybe in the context of Rwanda. So for us to achieve this, we need to look at what is the impact. Is really impact social? Has social implication? Is it sustainable? Is there any sustainability to make sure that this entrepreneurial activity is sustainable? So for us to understand this, we need to pick some examples in our main text. There are some entrepreneurship-driven social innovation that we picked from maybe we did some survey and desk review and desk research to see what is being done in Rwanda in terms of entrepreneurial activities that address social, which are socially, has social aspect in themselves. We can highlight some, for instance, at the ministerial level, the Ministry of Health. Although some of these innovations are maybe incremental innovation or they are imported innovation, for instance, the introduction of ICT in health, the use of open medical records. These systems have been working from other contexts, but Rwanda has customized it in its own system to make sure that you reduce queues. You reduce queues, you reduce bureaucracies in the systems to make sure that everyone have access. There's also what we call health management information systems and other solutions that increase efficiency of health system. There are many. We have some that are used within pharmacies, within health, different levels of health system, maybe the referral hospitals, they have their systems in a way that, for instance, what if you have been accessing health services and you are going to pay, there is money that you have to pay. In normal circumstances, we used to have some queues that you have to wait maybe for 2 hours for you to pay for the services that you have, you accessed. So these systems are helping in a way that they reduce those queues and bureaucracies. So at the community level, we might highlight maybe the importance of One Family Health. One Family Health is just an organization. It's a private organization which brings essential health care to 1.6 million. In fact, One Family Healthcare in context of Rwanda, it's just an organization which came in place to tackle issue of access to primary healthcare. You can imagine someone traveling 2 kilometers to get maybe simple medicine to cure maybe, let's say, flu. So we used to have some areas whereby someone can travel 2 kilometers or 3 kilometers to access just a tablet. Then family health, One Family Health brings those solutions to build buildings like what we call health posts. Then these health posts are given to private people, entrepreneurs. Those entrepreneurs might be nurses or someone with money to make sure that these health posts are operational. This initiative have really helped, Rwanda to make sure that people have access to basic health services through PPP, that is public-private partnership. And it is being operationalized within what we call administrative unit, the cells, their cells. There are around, I think, 4,000 and plus cells that are having this health. So these are the initiatives or social innovation at the community levels. Then when we go now to individual levels, we might highlight the use of smartphone technology towards self-management of type 2 diabetes in Rwanda. So this was just an innovation which was initiated by one of our postgraduate students. It is called Gororoka, which simply means, this is Kinyarwanda name, which simply means move for a better health, Gororoka. It was born in 2018, and it came from our postgraduate student, which in applied movement science and biomechanics. And he is a physiotherapist. He was looking at how can we tackle the issue of non-communicable disease and make sure that we bring solution closer to communities. And this Gororoka is just a mobile app, which actually help people to be able to subscribe within the app, and it brings all the solutions that anyone who wants to manage non-communicable diseases can get without going to the hospital. So it just provides a solution to manage non-communicable diseases. It provides also a platform to assist rehabilitation service, which are related to non-communicable diseases. And its ultimate focus is on self-management. So it also addresses the issues regarding access to specialized healthcare or health services delivered in Rwanda through rehabilitation. So it has also a database for such. If, for instance, you are looking for what can I do if maybe I have high blood pressure in terms of physical activity, what is the level of physical activity that I have to do to perform if I have high blood pressure? And one of its outcome, it has helped people to do daily monitoring so that you look at what is the level of your hemoglobin, lipid profile, and so forth and so forth. And the ultimate goal of this is to improve the quality of life. Then you might ask yourself, how is it an entrepreneur in itself? This came from just a student, postgraduate student. He has worked with some other organization to make sure that the app is operational. But anyone who the app, you have to do subscription, so that the owner can get some, some fund through subscription. So you can now see how the models are coming in. These are some other, examples of social innovation in context of Rwanda, which cover universal health coverage. These are some of the stakeholders innovation projects that you have, we collected from this that we did. One of them is called, one innovation is called My Doctor. This is a telemedicine application which deals with mobile payments and accessibility of medical services. And the owner is working with National Research Foundation from South Africa, So they are partnering together to make sure that My Doctor is operational. There is one which is student-led innovation, which is web-based. It is called DCare. It provides education and health, especially for teenagers, adolescent health and so forth. And it is also, it's a partnership between a private entity and one of Innovation Center, which is public, ICT Innovation Center within IPRC. This is a technical school. We do have like other maybe innovation that are, global, like community-based health insurance. You might question yourself, is it an innovation or something? This was recommended by the WHO, but when you look at how it is operationalized in Rwanda, to be able to have access to health services, it becomes an innovation because every citizen has to contribute to make sure that, there is access to health. It's a partnership between local governments, Ministry of Health, and others. So